QI Connect provides an opportunity for colleagues across health and social care and beyond to learn from international leaders in the fields of improvement, innovation and integration. My name is Gregor Smith and I'm delighted to be chairing this session today. Welcome to QI Connect. I'm now going to pass you over to Jennifer, who will tell you a little bit more about the session and the technology we're using today. Good afternoon, Jennifer.
Good afternoon, Gregor, and hello to everyone joining on the QI Connect today. It's great to have you, and we're so excited about today's session. So I just have a couple of quick housekeeping slides to get us started. If you could please use the chat box, the chat function that you see on the right-hand side of your screen to communicate, and I'll talk you through this in just a moment. If you are having any technical difficulties, such as not being able to hear the presenter speak, or if you keep losing connection, then please message the event manager using the chat function or by pressing *0 on your telephone keypad. So these sessions are designed to be an interactive learning experience, and so we do encourage you to use the chat function to share any questions, comments or ideas throughout the talk. There will be an opportunity for Q&A at the end of the session, and we will also be sharing hyperlinks within the chat function to any resources mentioned by our speaker today. So we did promise that today's session was going to be fun and interactive, and this is the really interactive part, so we're keen to find out where you're joining us from today. If you could please select the annotation tool that you see circled in red on the top left-hand side of your screen, and then click on the arrow icon to the left-hand side, and then select the country you're joining us from using the arrow. So hello to Alex, hi Chrissie. Hi Rachel.
Hi Catherine.
Hi Michelle.
My goodness.
This is where you see the UK just disappearing. We just always like to just give it a couple of seconds just for other people joining us as well.
Hi Caroline, Laura, and Tim.
So it's great to see so many of you joining us from in the
and we've got a first from the United States, Karen.
That's great. Well, welcome everyone to today's session. It's great to have you on. We're looking forward to sharing learning. I'm now just going to hand you back over to Gregor, who's going to tell you a bit more about QI Connect and some of the organisations who are going to be joining us.
Thanks, Jennifer. I'm delighted to say that we now have more than 1,000 organisations joining us for QI Connect. So, regular QI Connectors will know that this is the most important part of today's programme. We run a competition in each session, so get ready. The first person to click on the flag for South Africa. Now, an interesting fact, the original founder of Parkrun, Paul Sinton Hewitt, spent his childhood here. And do we have a winner?
No.
We now have 62 countries represented in our QI Connect community. Now, I am delighted to be able to say congratulations to Gordon Skilling, who is the proud winner of a much-coveted QI Connect mug. I have mine with pride on my desk back in Edinburgh. So Gordon, that's going to be winging its way to you shortly. Now, for the first time today, we have 16 new organisations, and you see some of their logos displayed on this slide and the next. And I guess this really reflects the real diversity of organisations that are now part of each one of these sessions. So hello to each and every one of you who's joining us today for the first time. I also want to say a big hello and welcome back to our representatives from all of our Scottish NHS boards, the logos of which you see on this slide. And of course, we're always delighted that QI Connect reaches our colleges and universities across the world, and we now have 77 of these establishments who link in on each occasion. The rest of our back catalogue is available to you to watch and enjoy on our website, and if you follow these links here, you'll begin to see some of the wonderful sessions that no doubt you've been able to participate in the past, but they're always worth revisiting for little extra nuggets that you develop along the way. Now, the QI Connect series now features an improved resource within the IS Fellowship Programme, and we're delighted that we continue a relationship with the Q project an initiative been delivered by the Health Foundation and supported and co-funded by NHS Improvement. I want to introduce you and give a big shout out to our QI Connect team today, and as well joining me in this room are Jennifer Graham, Alex Sterling, we've got Michelle, we've got Carmen and Jessica, and of course it's not quite the same unless we mention Brian as well. So big shout out to everyone. Hi everybody.
Hi. Hi.
I also want to introduce you to our lead questioner for today, which is a person very well known to me as one of the real estate medicine clinical leads and also consultant in public health medicine for NHS National Shared Services. That's Alex Sterling, and she'll be asking Chrissie the first question after today's presentation. One of the things that we think is really important with QI Connect is the commitment that we all make to sharing the learning from each session. So please, can I ask all of you to make sure that you're as active as possible on Twitter using the hashtag that you see on the screen just now, HISQI Connect. And if you're not already following us, follow us at the title HISQI Connect. So that takes us to what I hope will just be a very short introduction to someone who I've got to say is a real hero of mine, so it's an enormous privilege to introduce today's speaker. Chrissie Wellington, OBE, is a retired British professional triathlete, and she's four-time Ironman triathlon world champion. Amongst her other achievements, she also is very well known for the wins that she's had in the Challenge Roth Championship over the years, which I think Chrissie still holds the world record for that particular event. She is a former worker in the British government, a policy advisor in DEFRA, and now works full-time as the Global Head of Health and Wellbeing for Parkrun, which we're going to hear much more about today. So I've read one of her books, which is A Life Without Limits, and I'm delighted to see that there's another book here which looks well worth reading as well, called A World Champion Triathlete's Guide to Your Perfect Race. It's something that I'm desperately in need of looking at. So without further ado, I want to hand you over to today's presenter, Chrissie Wellington, and look forward to hearing all that she has to say. Chrissie, over to you.
Thank you so much, Gregor, for the introductions and warm welcome. It really is an honour to be asked to deliver a presentation to such a sizable and global audience, probably the biggest that I've ever delivered to. I actually have to admit I'm slightly daunted, not least because I'm quite technologically challenged, so trying to get my head around this WebEx system's been quite a challenge, but we've got there. So as Gregor said, I work as Global Head of Health and Wellbeing for an organisation called Parkrun, and in my previous career was a professional, kind of masochistic professional Ironman triathlete. However, nowadays I have to admit I am a slightly different sort of Ironman. Now, I'm assuming the majority of you don't want to hear my top tips, well maybe Gregor does, but the rest of you probably don't want to hear my top tips for excelling at swim, bike and run. No, I thought not. But although we come from a range of different backgrounds and specialisms, I think we're all united by one thing, and that's a passion for health creation. And I hope that I'm correct in assuming that we want to promote accessible, inclusive, regular, socially focused interventions that really do help people on a mass scale take their first steps to healthier, more active lifestyles. If that's the case, we really believe that the Parkrun model provides an example of how this has taken place, and that's why I'm so grateful for the opportunity to talk a little bit more about Parkrun during the seminar today. Now, if it's true that a picture tells 1,000 words, I'd like to start off with a photo that some of you may have seen. It went viral a few years ago. It's of a lady called Dawn Nisbet, and after about 17 years of being pretty inactive, in July 2016, Dawn, with the support of her friends and family, decided to try her local park run in Oldham. She finished 10 minutes behind all the other participants, supported by the volunteer tail walker and supported by everyone else at the finish line. And since then, Dawn has completed 64 5K park runs and volunteered countless times, including coordinating the entire event, and even gone on to do a half marathon. I'll just let you read this this quote from Dawn, which really sums up better than I ever could what Parkrun means to her. And I think more importantly than completing 5K park runs and doing half marathons, she's happier, she's more confident, she's more vibrant, and through this journey has also inspired her daughter to get out of bed, which as a mum to a daughter is no mean feat, on a Sunday morning to take part in junior park runs. And I know this is just one individual anecdote, but I think the beauty of the story is that Dawn's experiences are being replicated in communities all over the world each and every weekend. So without further ado, if you don't mind, what I'd like to do is explain a little bit about Parkrun and how we got to where we are, outline the strategic shift to target those like Dawn who are less active, highlight some of our flagship projects which enable us to do that, and most importantly, encourage you all, if you aren't already, to get involved. So Corinne, could we open up the poll quickly? So can I start off by asking how many of you have heard of Parkrun? Yes or no? And how many of you have been to a parkrun? Hopefully those numbers of yeses are climbing rapidly. But for the uninitiated, Parkrun started in 2004, and as it says on the tin, it was simply a run around the park. But in reality, it was never really about the running. As Gregor mentioned, Parkrun was created by a chap called Paul Sinton-Hewitt, who was actually born in what is now Zimbabwe and had moved to London. And in early 2004, unfortunately, Paul's marriage broke down, he got fired from his job, and he suffered a long-term running injury, which meant he could no longer compete for his running club. And these really challenging life events disconnected Paul from his three principal social circles. He felt increasingly isolated and suffered from depression. And I guess wanting a way to reconnect with his friends, Paul invited them to come to Bushy Park in London and run a 5K loop. He would time them so they could track their progress. It was free, anyone could come along, and Paul would be the volunteer who organised it. But the catch was that everyone had to go for breakfast and a coffee or two in the park cafe afterwards. And within 2 years, there were 600 people taking part every week. And yes, it did attract existing runners, but it also broke new ground in attracting a much wider variety of people, many of whom wouldn't have otherwise have engaged with physical activity. So there were elderly people, parents and grandparents taking part with their children and pushing babies in buggies, people running with their dogs, people walking and chatting. They weren't wearing lycra, they didn't belong to sports clubs, they loved the informality of just coming along whenever they wanted. These people were there for as much for the social element as anything else, and the opportunity to connect with friends and with family. So Paul's simple run in a park had actually become so much more. And people started to travel from all over the UK and from other countries to take part in the Bushy Park Run, attracted, I guess, to this intergenerational social activity that was as simple for volunteers as it was for all the participants. And many came to ask Paul whether they could replicate the concept in their own backyard. And Paul's response was simple and unequivocal, really. He said, I'll provide the technology, the equipment, the learnings at no cost, providing your event follows a set of fundamental principles, and it must be free, held every Saturday morning throughout the year, open to absolutely everyone, forever. If fast forward over 14 years, how would I describe Parkrun today? So Parkrun's a charity that oversees the delivery of 2 types of weekly community-led events in areas of open space. We have 5K events on a Saturday, and in 2013 in the UK, we launched the Junior Parkrun series, which are 2K events held on a Sunday morning, specifically for 4 to 14-year-olds and their families. All events are organised and delivered by local teams of volunteers, and there's a small, and I do mean small, team of paid staff, of which I'm one, undertaking the overarching strategic, operational, comms, financial, HR functions, and so forth. So our success and sustainability is predicated in part on the fact that we've always been demand-driven, in that an individual, small group of people within a community will approach Parkrun HQ, and then we basically facilitate the setting up of of that event. Although, as I'd hopefully get a chance to touch on later, we've recently taken more proactive steps to try and engineer and shape that demand. But crucially, Parkrun's dedicated to breaking down many of the barriers to participation in physical activity that we all know exist and the research shows exist. For example, our events are always free to take part in, they're held in public places, you don't need specialist equipment or clothing, you don't need any experience, you can turn up whenever you like, and getting involved really is easy. You just register once on the website, the Parkrun website, print off your personal barcode and head down to your local event and the finish line, where a friendly volunteer hands you a little finish token. And then you queue up and another volunteer, you can see here, scans your token and your personal barcode together. And these two items generate a time that is texted or emailed to you later that day. And I guess you might be thinking, wow, this method is really clunky and old-fashioned compared to automatic chip timing systems that you see in many kind of races nowadays. But it's there for a really, really important reason, and it stops people walking away immediately afterwards and nudges them towards all-important social interaction in the queue and, like you see here, when getting their barcode scanned. And also, through this technology, we can helpfully track participation and build up a really clear understanding of who is taking part, how often, and why. And after that unique finish line experience, as per Paul's wish, everyone is always invited to the nearest cafe for tea or a coffee and a chat, and you often find park runners still at that cafe long after midday. So Bushy Park has now grown from 13 runners on that first autumn day in 2004, here they are, to well over 1,300 people every single Saturday from all walks and I guess runs of life, as you can see in this picture. And in the UK, Bushy Park Run has been joined by, today, 595 other 5K events and 265 2K junior park runs, although we add new events each week, so every time I speak of these statistics, they're out of date. So around 170,000 people walk or run at those events every weekend, supported by about 17,000 fantastic volunteers. So in total, about 2 million people have taken part in Parkrun in the UK since 2004. And in 2009, Parkrun spread internationally. So today, there are over 1,700 events every single weekend across 20 countries around the world, which you can see highlighted on this map. So they go from the deserts of South Africa to very frozen high fives in Russia and Scandinavia, and from Canada to Singapore, down to Australia and New Zealand, and we're adding countries year on year. So far, over 5 million people have registered with Parkrun, and every weekend around 300,000 people take part around the world. And obviously there's no doubt that these numbers, yes, they are impressive, but they don't tell the full story. And if we're only providing an activity for people who are already active and already have a strong social circle, then what are we really, really achieving? We need to delve deeper and be driven not by the high-level stats, but by the granular detail, knowing who exactly is taking part and what the benefits are of doing so. So this is Elizabeth Maris. Elizabeth lives in a care home opposite Bushy Park, and every Saturday her carers, or sometimes her daughter, bring her to the park so that she can cheer and high-five all the people taking part. And she's become such an important member of the Parkrun family that the team have made her an honorary marshal, complete with her own high-vis vest. And since joining Parkrun, she has a whole new circle of friends. And at Christmas time, as you can see in this picture, she's absolutely inundated with cards and presents from the local community. And what this example hopefully shows is that Parkrun truly is open to all. People can take part in Parkrun in whatever manner suits them, whether that be to walk, to run, to volunteer, or to come along and watch and, like Elizabeth does, enthusiastically high-five everyone. And of course, everyone has their own reasons for taking part, but whatever their individual story, their health status, fitness level, age, gender, or any other demographic trait, they can take part on an absolute level playing field with everyone else. But everyone is united by the simple concept of being a park runner. And it's really this connection and this unity that is so incredibly important. If we really, really want to address some of the deep-rooted social and health inequalities, we have to be prepared to do more than simply provide opportunities to do X minute of exercise, especially that undertaken alone in a more sterile indoor environment. We really need to address the root causes of ill health. We need to listen to people, understand their challenges, empower them, and give them the confidence in themselves to make their own positive choices. We need to build relationships, connect people with others and the environment around them, and create some more supportive communities centred on wellness. I'll just let you read these two quotes from members of the Parkrun family. And we believe that it's this community intervention that is the true value of Parkrun. So viewed through this lens, it isn't surprising that over the past few years, we've consciously moved from being quite a reactive organisation, facilitating parkruns wherever and whenever people wanted them, to more proactively taking steps, like I referred to before, to shape the demand and engage those who would really benefit most from what we offer. In other words, I guess bringing parkruns to communities and individuals who are the least likely to engage, but potentially have the most to gain. So to reflect this shift, we made it our strategic mission to create a healthier and happier planet. And this means taking much more of a strategic approach to encouraging participation by those who are less active. And in this regard, our efforts are built on 5 main pillars. Firstly, our work is underpinned by data, research, and the development of detailed insight. And like I said, we have a clear picture through our simple but paradoxically quite sophisticated technology about the millions of participants. So, for example, their age, their gender, their level of activity before becoming a parkrunner, and their postcode, which we can link to indices of multiple deprivation. And we use this insight to develop targeted interventions and then, of course, evaluate our success. And then secondly, we've completely overhauled our public narrative and imagery to move ourselves away from being seen as a running event for traditional runners, to garner the images of white, skinny men on the start line, and they've been replaced by photos and stories that we hope will resonate with the people that we really want to engage. So in other words, we're trying our best to redefine what it looks like and means to be physically active. We've also made operational changes, again, based on the insight we developed, for example, ensuring that events have first-timer welcome briefings. Many events also provide specific support, such as guides for visually impaired and blind park runners, and we have volunteers in the UK here trained in British Sign Language. I referred to them before. We also have mandatory volunteer tail walkers who provide support and encouragement and ensure nobody ever finishes last, so they're always the last person to cross that finish line. And outreach into target communities is absolutely vital, and we have a network of champions and ambassadors who actively stimulate the demand for parkrun events and encourage participation. They're role models within their communities, and hopefully they're the people that really will resonate with those that we're trying to engage. And finally, we have targeted interventions or projects, such as those aimed at people with long-term conditions or young people from areas of social deprivation. And hopefully some of you have heard that we, in 2017, took the groundbreaking step of launching parkrun events in prisons and young offenders institutions here in the UK and in Ireland. We now have 13 of those events with many, many more in the pipeline. And although this intervention and some of the others that I've mentioned are focused on the UK, as you might expect, we have significant global ambitions. And so a lot of them will be rolled out into the other Parkrun territories in due course. But if we look at some of the UK stats for a moment, our efforts really do seem to be working. So I'll just show you a few graphs here. So in 2018, over 400,000 parkruns were completed in the UK by participants who were previously inactive. 400,000. The share of total walks and runs completed is rising and is at 5.9% in 2018. 700,000 parkruns were completed by participants from the most deprived quartile of the UK in 2018. And this is one thing we're really proud of. There's been a sharp increase in the number of walks. So we take about 50 minutes as the proxy for walking at Parkrun. So the numbers have been increasing, and there were close to 100,000 in 2018. And I think we're probably the only kind of physical activity event that celebrates when the finish times actually get slower. And ours are. The average finish time is getting much slower year on year, and it means we're becoming more successful in attracting those who are, I guess, quite literally taking their first steps towards better health. So with all of those building blocks in place, over the last few years, we've begun to collaborate a lot more closely and deeply with the health and social care sector on a variety of initiatives and campaigns. Hopefully some of you have heard of this, if not, were actively involved. So in June last year, we partnered with the NHS to celebrate the NHS's 70th birthday here in the UK, and we invited all of our 800 parkruns to hold special celebration events, which included dressing up in medically themed outfits, and some people even carried wounded blow-up dolls on stretchers, which was quite amusing and made for some good photos. I didn't put one up on here. But encouragingly, that weekend saw a 14% increase in participants, 1,000 of whom rated themselves as inactive when they signed up. And we also saw a 37% increase in first-timers, from 9,000 up to 12,000 that weekend in June. And the success of the NHS Celebration Day, as we called it, provided a really solid platform for us to launch a really, really groundbreaking project with the Royal College of GPs here in the UK, which we've called the Parkrun Practices Initiative. And if I may, I just wanted to explain a little bit about this project and how it came about. So we started to realise that healthcare professionals of all specialisms were actively signposting patients and service users to Parkrun. And this was actually backed up by a survey we carried out in 2017 that revealed a third of the 2,000 respondents from across the health sector were already doing some form of what we call social prescribing. So not necessarily saying go and run 5K, but more of a gradual introduction to activity. So the suggestion that patients get some fresh air, see people like themselves, make friends, be inspired to make other changes to their own personal lifestyles. And in fact, the Sloan Medical Practice in Sheffield actually went a step further and took it upon themselves to actually launch their own Parkrun event. Unfortunately, the nearby park was called Graves Park, meaning that the first event in the world to be set up by GP practice is somewhat inappropriately named Graves Parkrun. But the second catalyst to launching the Parkrun Practices Initiative was that the patients themselves were sharing some incredibly personal and very, very inspiring stories about how Parkrun had changed their lives. So take Brian, for example. So Brian started parkrunning in 2017 following a suggestion from his GP that he become a little bit more active as a way of managing his mental health, which has been a challenge for him ever since he had been little. Brian's about to celebrate his 100th parkrun and has also volunteered numerous times something I think by his own admission he couldn't have ever have envisaged doing. And this is a quote from Brian. I actually received an email from Brian over the last few days, and he wrote to me, he said, "I've not taken any antidepressants for over 2 years. Running is my medication now." And it really is stories like Brian's that compelled us to work with the Royal College of GPs and get the Parkrun Practice Initiative off the ground. So how does it work? Yes, in practice, pardon the pun. So it's quite simple. It's a partnership between the GP practice and the Parkrun event, whereby the practice agrees to promote Parkrun through various channels, whether that be handing out flyers, putting up posters, displaying videos or slideshows in the waiting rooms, verbally signposting patients to the events or their carers or guardians, encouraging staff to take part, having staff leaderboards, or even doing practice takeovers, which is basically where staff and patients undertake all of the volunteer roles at a Parkrun event on a specific weekend. And to help guide this, we provided a toolkit which provides support, advice, resources. But we really want practices and Parkruns to be creative and come up with new and fresh ideas for making this collaboration work. But the toolkit I mentioned is publicly available on the RCGP website if you want to take a look. But to get involved, we first encourage the practice staff to go down to their local event, experience Parkrun for themselves and chat to the volunteer team. And the practice can then register to be an official Parkrun practice via the RCGP website. They're then sent a certificate, which we really hope will be displayed prominently in the waiting room. And importantly, it's a self-declared trust-laden process, so we're not going around strictly adjudicating the activities against certain rules. But since June last year, nearly 700 practices have registered, with many, many more being added each week. So if you think that there are currently 595 5K events in the UK, that's an absolutely amazing start. And we're really, really excited, especially by the way that the concept has been embraced by the prison service. So at the moment, as I mentioned, there are 13 Parkrun events in prisons in the UK and Ireland, and some of the prison medical centres are now certified as Parkrun practices. So I don't need to tell you who are involved in health and social care what the benefits of being a Parkrun practice are. I've listed some of them here on this slide. And although at the moment it's formally called a Parkrun Practice Initiative, the process really can be undertaken by anyone working in primary or secondary care. In fact, we've been buoyed by the responses we've had from other professional bodies, including physios, and I saw the Chartered Society of Physiotherapists logo flash up there. So it's great that this society's shown an interest, and we've had interest from pharmacists, occupational therapists, link workers here in the UK, and actually around the world, from people and umbrella bodies all wanting to replicate this initiative. And I'd just like to encourage all of you who are involved in health and social care in some way to consider signposting people to Parkrun. As I said, we have the assets, or we can produce territorially specific assets that can be used by anyone. And the benefits for you and your patients can be absolutely incredible. So to finish off, I'd like just to give you a few suggestions for how you and your organisations can get involved in Parkrun. So most importantly, hopefully through this presentation, I've encouraged you to walk the talk and become a Parkrunner yourself. Just head down, whether you want to volunteer or walk or run or jog or just spectate, and see for yourself what it's all about. Encourage your family, your friends, your colleagues to come and take part. Like I mentioned before, signpost any patients and service users that you think might benefit from Parkrun to our events. Obviously, GP practices in the UK can become a Parkrun practice, and like I said, I hope we can replicate this initiative in other countries around the world. And also importantly, share these personal stories and case studies with us, because it's only by us receiving those and then in turn sharing them with the community that we can create best practice examples and role models for others to follow. So thank you again for taking the time to listen to me, to Gregor, to Jennifer, and everyone at QI Connect for giving me this amazing platform to speak just a little bit about Parkrun. And I really look forward to answering some of your questions, and my contact details, Parkrun's contact details are on the slide there. So please do connect, do get in touch, and hope to welcome you as part of the Parkrun family next weekend or in future. Thank you.
Wow, Chrissie, thank you so much. That was absolutely fabulous. And, you know, I've participated in a parkrun myself in the past, and it really is the most wonderful, joyful event. And I would encourage people, if you haven't given it a shot, you've heard it's really inclusive and you feel really connected with other people at it. Give it a shot this weekend. It's dead easy to sign up. So we now go over to Alex Stilling, who asked the opening question. And I'm just trying to line up the next slide, but I haven't got the ball back, Jennifer.
Okay. I'll just ask Corin just to pass the ball back to me. That's okay, Corin.
So Alex, over to you for the opening question for our question and answer session. In the meantime, can I get all of you to keep on thinking? Some of you already submitted your questions, but please either get your questions in using the chat box or on Twitter, and we'll start to collect some more questions for Chrissie after Alex has asked hers. So Alex, over to you.
Thanks, Gregor. Hi, Chrissie. Thank you very much for that really inspiring talk. Everything you're doing at Parkrun really fits in with the work we're doing in Scotland around realistic medicine, and it's great to hear how you're increasing your reach to some of the more vulnerable and disadvantaged groups who have probably got the most to gain from participating in this activity. Can you tell me a bit more about how some of the initiatives, such as the work with the prisons, came about and how you've managed to grow this into such a success and what we can learn from it?
Yeah, I'll first touch on the prison Parkrun project, as we call it, and then more generally how we're hoping to engage more marginalised, less active demographics in Parkrun. So the prison Parkrun project came about due to demand. So we received an email back in 2017, early 2017, from a PEI, physical education instructor at HMP Haverig, which is up in Cumbria in the UK, inquiring about the possibility of setting up a Parkrun. And I think had that inquiry come in a few years previously, I think we would have just said no. You know, it's not what we do. It's outside of our normal operational model, and that would have been that. But given this strategic shift and our desire to, like I said, engage those that are more vulnerable or disadvantaged or isolated or disconnected, we were open to the idea, and we worked with HMP Haverig to activate that first event in November 2017. So like all Parkruns, it's in areas of open space, so it's in the prison grounds, it's 5K, and it's held on a Saturday morning, and it's open to as many different prisoners as possible. What we don't want to do is for it to be only for you know, those that already access the prison gym facilities, for example. We really wanted it to be open to all types of prisoners. We also, very importantly, wanted the prisoners themselves to deliver the event as volunteers. We now have 13 events, 12 in the UK and 1 in Ireland. So far, over 1,200, I think it's 1,260 different people have taken part in prison Parkrun. So they are mainly prisoners. There are a few visitors, such as myself, that have gone in and taken part, and a couple of staff members. So with well over 1,200 prisoners have already taken part in those events. We've had about 30 other inquiries that are in various stages of activation, and we're really proud anecdotally at the moment of what we're achieving, and we're working with the prison service to more formally evaluate this, the impact of this initiative. So in terms of engaging vulnerable, less active demographics, you know, this is our raison d'etre now, and like I mentioned in the presentation, there are various ways in which we do this, and data and insight is incredibly important. So we need to know, you know, who our community is, you know, who is registering and not participating, and who is participating, who then might stop participating, and what age are they, what gender, et cetera, et cetera. So developing a really clear picture about our participants. Vitally, we need to listen to people and try to understand their own context. I mean, we can't always do that on a very, very personal level, but reaching out to members of the type of communities that we think we'd like to engage and understand what the barriers might be, what the motivations are, what the opportunities, what the challenges are. So it's really being able and being prepared to listen and not thinking that we have all of the answers. Nuancing our messaging is very, very important. So both in terms of our PR, so making sure that we articulate the fact that Parkrun really is open to all, because people hear Parkrun, they think it's for runners, and that's understandable, but we really want to try and convey that you can come along and you can walk. You don't even have to walk the whole 5K if you want to do part of it, that's fine, or just come and watch, or do one of the volunteer roles. So that nuancing that messaging is very, very important, and then messaging through our outreach ambassadors. So we, in HQ, in our ivory tower, can't hope to penetrate all of the different communities. So we have to have people that can go into those communities and really listen and talk to the different people that we'd like to engage. And then, like I said, developing those targeted interventions. It's no use having a one-size-fits-all strategy. So within demographics, so for example, women, you're going to have, you know, women are just not one, you know, uniform grouping, and we need to develop sub-interventions to engage different demographics. So hopefully that's touched on what we're trying to do, but it's work in progress, and we're very much learning as we go and learning from other organisations too.
Thanks, Chrissie. Wow. Can I just build on one of the points that you were making there? Because in a piece of work that I've been involved in, one of the challenges that we've noticed is again, just keeping young women involved in exercise outdoors, and I'm thinking particularly in the age groups from kind of 12 to 18. And we've done some kind of research as to some of the reasons that sit behind why there's a reluctance to become involved in that. I just wonder, from the demographics that you know of within Parkrun, are you seeing any growth in that field just now?
It's interesting that you touch on that. I think it's common, you know, that across the physical activity sector that engaging in a sustained way young girls, young women in physical activity is very, very difficult, and Parkrun is no different. And that's one of our biggest challenges at the moment is trying to increase participation by young girls, or by girls aged around 13 to 19. You have the traditional bell curve, and yeah, there's definitely far fewer participants in that age range. And I think that's where junior Parkrun for us is so important. If we can engage them in enjoyable, social, empowering physical activity from a young age, and one that involves the whole family, hopefully that will encourage sustained participation and sustained enjoyment of being active in, you know, in various forms throughout their lives. We also need to look closely at our marketing and closely at, you know, at the barriers. So potentially having more role models that might resonate with that particular age range and that, you know, that particular demographic could be could be very important. And we look to the This Girl Can campaign as a way of doing that, and want to work more closely with Sport England to build on that campaign. But it's definitely, for Parkrun, a challenge as it is across the sector.
We've got some great questions coming in now, Chrissie, and can I just, Julie Alexander, who's the Principal Physio down in South East Trust, is asking, you have 2K run on a Sunday for younger participants. Is there a possibility of something for the other end of the age spectrum, older people perhaps with walking aids and a shorter distance?
At the moment, we want to stick with our operational model, so 5K on a Saturday or the 2K junior park runs on a Sunday. And I think it's about us articulating that although on the surface a 5K run might seem too daunting for an elderly person to take part in, to use this example, as I tried to articulate, anyone can come along. They can take part in Parkrun in whatever way they choose. So they don't have to do all of the 5K. They could do some or all of it. They could also volunteer. They can do what Elizabeth does and stand on the sideline and cheer and high five. And in our mind, that is being physically active, because you're walking around the park, you're in the open air, and you're socializing. So there's so much more to physical activity than just moving your body. It's about community, it's about relationships, about social interaction. So what our data is showing, that we're actually becoming more successful in engaging older participants in volunteering as much as walking and running. So that's something that we're very, very encouraged by. Obviously there's more work to be done, but at the moment what we want to do is encourage everyone to take part in 5K rather than creating little silos for different demographics, if that makes sense.
Yeah, and there's a great practical question here from Lucy Wilson-Shaw, who's from one of the NHS Foundation trusts in London, and she says, what advice would you give on approaching councils who are not keen on giving permission for Parkrun? She says that she works in central London, and I think Kensington and Chelsea and Westminster are the only London boroughs without a Parkrun. Are you aware of any reasons why this is?
Yeah, on rare occasions there are challenges with the landowners. The councils you mentioned are a case in point. What we need to do is carefully articulate the health economics that lie behind Parkrun, and it's something that we're trying to quantify in partnership with Sheffield Hallam University, who chair the Parkrun Research Board. So add a monetary value to the cost savings that are incurred at a national level and then at a more local level by councils because of Parkrun. And I think, you know, money does talk in this day and age of austerity, and I think it's adding that monetary weight to the anecdotal benefits of Parkrun that can really help to persuade councils. But unfortunately, in some instances, the councils simply, you know, won't grant permission, and we hope that those in the surrounding boroughs, for example in London, will have Parkruns. They're very evenly spread across London now, so that access for those residents won't be too much of a problem.
Thanks, Chrissie. I think the partnership with the Royal College of General Practitioners is fabulous. And Akintoye Akinola from the Golden Jubilee Hospital up here in Clydebank is asking, is there any possibility of events specifically for NHS staff, perhaps during lunch breaks, to encourage them to take more activity?
We'd like to encourage staff across the health and social care sector to take part, including those working so hard for the NHS. and encourage them to take part in Parkrun. We are not looking, as I mentioned before, to branch outside of our weekend activities, so we won't be delivering events, for example, on a weekday, but there's nothing to stop staff members from, you know, deciding to be active in their lunch break and then coming along to Parkrun on the weekend.
Thanks, Chrissie. I'm going to go to one of my colleagues in Scottish Government now from the Leading Improvement Team, Fiona Montgomery. So her question, she makes the comment, first of all, it's a great overall vision, a healthier, happier planet. But how will you know if you're making a difference? Do you have a more specific aim that you can measure to know if you're making a difference towards that aim?
Oh, what an absolutely fantastic question. So I mentioned very briefly just now, we have a partnership with the Advanced Wellbeing Research Centre, which is based at Sheffield Hallam University. So they chair the Parkrun Research Board, and the Parkrun Research Board basically has two roles. The first is to filter all of the requests that we receive to undertake research into Parkrun. So as you can imagine, we're inundated with requests from anyone from, you know, an undergraduate student all the way up to preeminent academics who want to use Parkrun to source subjects for their research or to utilise Parkrun data. So they filter those requests on our behalf. And secondly, the research board and its members actively undertake research into the health and well-being impacts of Parkrun. So a number of different papers have already been published on Parkrun and its health and well-being impacts. We commissioned Sheffield Hallam University last year to undertake the first UK and Ireland health and well-being survey. So that went out to over 2 million Parkrunners last November. We had about 100,000 responses. So Sheffield Hallam University are now knee-deep in data, analysing those results, and are due to report on that this week and into March. So the findings from that snapshot survey will be the first UK and Ireland-wide attempt to quantify and understand the health and well-being impacts of Parkrun. And we've also done a longitudinal study whereby we surveyed people when they'd registered, the week they registered and hadn't done a Parkrun, and we will then survey them 6 months down the line. So that will give us the longitudinal impacts of Parkrun on their health and well-being. So that's a really, really exciting piece of research, and that will be made available in due course. And if any academics are interested in finding out a little bit more about how they might be able to use Parkrun as part of their research, then by all means get in touch with me or the Parkrun Research Board, and we can provide more information on that.
Chrissie, thank you very much. What a beautifully engaging presentation we've heard this afternoon, and really I think there's so much that we can learn. We've been captivated by the stories of Dawn and Elizabeth and Brian, and see a lot of love in the chat box towards what they've managed to achieve through their participation in Parkrun. We're really grateful for you to tell us the story. I think there's a lot that we can learn from Parkrun, and particularly your spread plan must have been absolutely amazing to kind of go and develop the events in the way that it has over the years. So I want to say a huge thank you to you for participating today, and also just to say to all our listeners that we've got a number of questions that we haven't been able to turn to today, but we'll follow up those questions with Chrissie and try and get back to those of you who've asked. So Chrissie, thank you very, very much. Next time,
it's an honour. Thank you.
As we move on to our next speaker, we're going to take a break from March, but we'll be back in April with Frank Federico, who's the Executive Director in Institute for Healthcare Improvement. And as you see the programme for the rest of the year, I'm sure that you'll agree this is a fantastic lineup that we've still got to come over the course of the rest of 2019. So please stay in touch with us. You know how to keep up to date with all the developments for HISQI Connect. Follow us on Twitter and connect with us that way. Share the learning from today. But finally today, I just want to thank all the team who were involved in giving us this opportunity to hear from Chrissie, and to Chrissie herself for what was, I'm sure you'll agree, a fabulous presentation. So thank you.